All right, Dr. Emer, you are live.
Hey guys, it's Dr. Emer. We're in West Hollywood and we're at the end of the day, and we're doing a great treatment today. This is actually one of our new favorite treatments called TRUSCULPT Flex. As you guys know, there's a lot of devices now coming out on the market that tone and sculpt and define patients. You know I do high def lipo. This is one of our in-office. Is it okay in terms of energy? Okay, let us know. You're doing twerking right now. This is the twerking procedure. No, but this device tones and sculpts the muscle and helps give definition. So in those people that already work out, that want more muscle mass, that want to look more defined, they can do this treatment. If you've had surgery and you want to enhance the results of surgery, you can do this treatment. It's not really a fat reduction. This is toning and tightening. It's great for my patients that do Sculptra on the buttock to lift the buttock. Similar to m-sculpt, which a lot of people are talking about for buttock lifting and for tightening of muscle. This actually does double the amount of muscle mass increase in the studies, and it has 16 applicators. So take a look, 4 applicators per thigh, 4 applicators per buttock. You cannot do that with the m-sculpt device. This has much higher energy pulsing. All of the energy gets distributed to muscle versus only a percentage of the muscle getting the delivery of the energy. And this device also has 3 different modes: the prep, the tone, and the sculpt. Prepping is like stretching before your workout, the toning is like twisting and defining, and the sculpting is multiple contractions. So we've already gone through, she just did a tone mode, right? So
no, she started,
she's
yes,
on tone
yeah,
right
she started right at tone.
So we're increasing the energy right now. It's gonna go for 45 minutes, and our goal is to stimulate the muscle, get it to define, tighten, and lift. In a series of 4 treatments, most people get about 30 to 33% increase in muscle density, a little bit of lifting. How does it feel when it's pulsing?
Pretty tight and strong, like a.
Does it feel like electrical, or does it feel like squeezing? What is
like you can't move.
You can't move. It's contracting the muscle. Yeah, exactly. So yeah, it seems like it's just, so minimal, but after a while, remember, lactic acid and other enzymes get released from the muscle. Your muscles are going to get tired like a workout. You may even feel tomorrow and the next day that delayed onset muscle soreness, or something called DOMS, that happens after you work out, because this device is literally working you out. And so those that get Sculptra, those that work out, those that have had fat grafting or high def lipo, you need to be doing this treatment. This is something that you would do a series of 4 to 8 treatments. The recommendation for this one is a couple times a week for the first series, and then I would tell you at least once a month if you could. You will look amazing if you do, and if your body is a part of your lifestyle, you would make this a part of your lifestyle.
When do you start seeing results?
You usually start to see results at about 2 to 3 weeks after treatment. But I will tell you, in the series, if you do 2 and 2 in those first 2 weeks, 2 weeks afterwards, most people are really starting to see an improvement. Now we can go up to a really high percentage, and since she's an athlete and super athletic and fit, how does it feel?
That was really strong.
That was too much? Tell her, because we can decrease it, but are you used to it now though?
Not, and now it's different because now it's moved to
Yeah.
like my.
Well, let's see what happens, because it's gonna go through that contraction mode, and then you might feel it a little bit more. But we can always go down. So this is the TRUSCULPT Flex, you guys. It really is pretty intense. You see, with its squeezing and tightening. Seema, are all of these activated at once?
They are activated separately.
That's right. So they'll go at different times. But in general, they're all activated, but sometimes they'll be working differently, and sometimes they're working in different modes. But you can see, look, she's getting contraction, and if it gets too intense, we'll go down. But remember, as the time goes on, you might feel it a little bit more. Is anyone asking any questions there, or no?
Not at the moment.
They're not?
Nope.
Surprised.
No.
All right.
Let me check.
How does that feel right there? What did that feel like? Because your muscle literally just picked up. It looks like a squat.
That felt more like comfortable than the hamstrings.
Oh, that's so cool.
Yeah, it was more like pressure.
Yeah,
this
that
is
makes
more
sense.
like kind of like a push.
Got it.
Somebody said, so is this like a really intense workout via EMS?
Yes, it is. It's exactly what it is. The difference with most EMSs, though, is they're delivering direct energy, and not all of it gets directly into the muscle. With this, there's different modes that allow it to get almost 100% of the energy delivery. So yeah, this is TruSculpt's new baby, Flex, and you can use it all over the body. You can use it on the abdomen, we can do it on buttock and thighs. And soon, hopefully, arms coming up. So if not any other questions, that's it. And we'll show you results as we start to do more treatments. Bye guys.